Hi, I'm Belinda. I'm a nurse practitioner here at Health Horizons.
Can you explain what causes moles, skin tags, and how common they are?
Moles are nevi, referred to as nevi, and they're usually benign non-cancerous growths made of pigment-producing cells and called melanocytes. They can be present at birth or congenital and develop during childhood or adolescence, and sometimes they fade or disappear over time. They come in various colors such as tan, brown, black, pink. The shapes can vary and the sizes can vary. They can be raised or flat.
Can you walk us a little bit through the process of what patients should expect when they're doing mole or skin tag removal treatment here at Health Horizons?
So the first process is really observation. We start off with the ABCDs. As far as warning signs for the ABCDEs, so A stands for asymmetry. So we let the patient know if they see any asymmetry in their lesion, that's something to keep an eye on. The borders are irregular, scalloped, or poorly demarcated. The color seems to be off. It's not uniform. It's uneven in coloration. The diameter is larger than about a 6 millimeter size of a pencil eraser. That's something to keep in mind. And evolution meaning it's changing in size, shape, or color, or symmetry, whether it's itching or burning, has tenderness or bleeding. Those are some things to cause concern. That looks at the different morphology of the lesion, whether it's the shape and color, and whether it's growing or not growing, if the color has changed or it's painful or itching. There's various things that we look at before deciding whether it needs biopsy or whether it can just be removed altogether.
How do you end up deciding what's the best removal method based for that patient?
So depending if it's benign looking, we want to make sure it's benign looking. First of all, if it is, then we proceed to various types of removal. So one of them could be laser, and not necessarily needs to be removed by laser. It could be removed by what we called electrocautery bovi. That's what we have. And in just a regular setting, the little numbing and removal, the time to repair the tissue is usually a couple of weeks. So we let the patient know that it's going to form a little crust or be a little red for a couple of weeks, and then it'll go away. With any type of lesion that keeps coming back, those are the ones that need to be referred on to dermatology.
Is this process or procedure painful at all? And then what types of numbings or comfort measures do you end up using?
So the process is not painful at all. So first of all, I think first thing people think of is pain, and it's totally not a painful procedure. They're quite often surprised that when I say we're done, they're waiting for me to begin. So they're happy about that. So it's totally not painful. We do numb it with 2% lidocaine, epi, and some use of epi in some instances. Depending if we decide that that's a vascular area and it's going to bleed, we'll go ahead and use epi. Typically, it's not painful at all. The patient doesn't feel anything.
Can you talk a little bit of what the recovery would look like and how should the patient care for the area afterwards?
The recovery usually takes about a couple of weeks. It's just keeping it clean and dry. That's basically it. We also let the patient know any signs and symptoms of infection that may arise. If they do, then they are to give us a call. We'll take care of it from there.
Do they need to use any type of Neosporin or anything like that, or just completely dry?
Neosporin, there are some people that really believe that Neosporin should be used. I just think that if they keep it, in some instances, covered with Aquaphor or some kind of barrier, that seems to work out just fine.
Can the treatment be done the same day as the consultation, or is this going to be a process where they come in for the consult and then come in for the procedure later?
It depends on how many lesions they have to remove. If it's going to take me more than 20 minutes, I do prefer to have somebody come in later that day or later on during the week for removal so that I have ample time to numb them up. And if I need to biopsy any lesions, I have my formula to put that in and send off to the lab. If a biopsy is needed, we will send that off to the dermatopathologist. Usually reading comes in within a couple of weeks, and we will let you know whether it's positive or not. If it is positive, we will refer you off to dermatology for further workup.
When you're looking at these types of patients, can you walk us through what's your favorite part of helping patients through this process?
I think that a lot of these lesions have bothered people for a long time, and they're more than happy to have them off. And a lot of times they don't know that they can have them removed. They think that they need to go in to see a dermatologist. Now, if they've had a history of skin cancers in the past, Typically, they go in every 6 months for follow-up to the dermatologist. But if they're benign, and a lot of times the dermatologist will let them know that it's cosmetic and it's not covered by insurance, so often they won't have them removed. Skin tags are typically soft, benign, non-cancerous growths or lesions, usually flesh-colored or slightly darker, and often found in folds or areas of the skin that rubs together. Common causes are usually friction, obesity, hormonal factors can cause it, diabetes, insulin resistance. Pregnancy can cause it as well. They're typically nothing to worry about. They're harmless. They can be removed fairly quickly, easily. They're usually not very vascular either. Not a lot of bleeding when it comes to removing them as well. When you come into the clinic, typically we look at the area to be treated. If you have skin tags anywhere from 1 to 5, we can typically remove that within a half-hour visit. If you have more than that, that will have to be scheduled ahead of time so that we can prepare for numbing several areas and possibly have to use different methods of removal. Typically, when removing any type of lesion, there's always going to be some sort of scar left. I know a lot of people worry about that, but it's usually minimal to what they're coming in for. Scarring can vary depending on how we remove the lesion and skin type as well. That if it bothers you enough, then whatever is left over is usually minimal.